Hello, my name is Asra. I'm a GP trainee in Northwest London, currently in my final year of training. I'll be doing a video today on top tips on starting foundation training. The reason I chose this topic is because, especially from my personal experience, I found it quite daunting from being a medical student to suddenly becoming a doctor overnight, and from having no clinical responsibility whatsoever to suddenly making clinical decisions, assessing patients, being part of a team. I hope this video will be useful for you. At the end, there are some links that you can use, and you can send me some messages on Instagram, on Facebook, for example, and I'm very happy to answer those. Always happy to help. I'm very interested in medical education, so please do let me know if you have any questions at the end. So, starting as a foundation trainee, you would have gone through all of your medical student training, you would have done all your finals, SJT, PSA, so thankfully that is all out of the way. And hopefully you would have received the offer that you desired, at the location you desired, the rotations that you desired as well. So hopefully all of that went really well. However, now you're going to start as a doctor. It's very important to approach this in an organized way, and also definitely make sure that you familiarize yourself with the different jobs that you have to do as a foundation trainee in the different rotations. So before you start foundation training, make sure that you know what you have to do during your different rotations. So you'll usually have 3 in a year, each being about 4 months. Get in touch with the foundation trainees that are currently doing that job, whether you're an F1 or F2. There will be an initial shadowing period for about a week, whereby as a final year transitioning into being a foundation doctor, you'll be shadowing an F1 for a week. Definitely make the most of that, because they can give you tips on what best to do during that rotation and what kind of things, for example, the consultant might like that you do during a ward down. So if it's preparing all the notes before the ward down, so you might have to come early. If it's certain jobs that they want you to do before the ward down as well, like if you're on a surgical rotation, they might want you to put all the bloods up, all the images up, all the x-rays that patients had, and document clearly in the notes as well. Also, familiarize yourself with all the equipment on the ward. So where's the crash trolley, for example? Do they use paper drug charts? Do they use electronic drug charts? During the shadowing period, you'll get to experience what it's like doing the different shifts as well. So whether it's a twilight shift, a regular day shift, which is from 8 till 5 or 9 to 5, and also a night shift as well. So see what different things involve and entail, because, for example, during a night shift, it might be that you have to take the handover from the day team and then do jobs during the night. So you'll be mainly assessing sick patients. The nurses will be bleeping you from the wards as well, and they'll always contact you first because you're the F1, and then following the hierarchy, you will report to your SHO or your registrar when you're stuck with things, or when you need help with certain jobs that you have to do, or if you're obviously seeing sick patients that require escalation. And before you finish a night, for example, you're expected to update the list and hand over everything to the day team as well. During the day shifts is slightly different, so you'll be taking the handover from the night team. You'll be most of the time following a ward round with the consultant. So it will be, for example, on a surgical ward or a medical ward. You'll be seeing all the patients, including all the new admissions that came in through the on-call team and the take team. And with those patients, you would have prepared the notes, for example. You write down a plan on what you need to do. And at the end of the ward round, you'll be expected to do the jobs for that patient. So That could be taking bloods, that could be doing an MMSE, for example, or MOCA, which is like a cognitive assessment, especially if you're on the care of the elderly ward. It might involve you referring the patient to a different specialty. Also, throughout the day, if a patient becomes acutely unwell, as the most junior doctor, you will have to attend to that patient and manage the patient using an ABCDE approach and your basic management skills. So with ABCDE, you go through airways, breathing, check the lungs, check the chest, circulation, check the observations, of course. Is the patient responding well? Is the patient unresponding? When you check disability, check their pupils, expose the patient, check if they're, especially on the surgical ward, are there any signs of bleeding from the wound side, for example. So I'm sure you're familiar with all of that, but it's just important to go through that initially. Once you've tried to stabilize the patient, with help of the nurses, of course, do make sure to contact your senior, so the SHO on the ward, your registrar. If there's no registrar around or no other senior, you can always give a call to the on-call registrar, whether it's a surgical or a medical registrar. And they'll be happy to help, and that's what you're supposed to do. You're always supposed to escalate to the most senior. You do your basic management, and then you escalate as well. All right, so that's what it's like during the day and the night, and during the ward rounds, doing the jobs afterwards as well. Make sure that you split the jobs amongst yourself, so amongst all the foundation trainees on that rotation, and that everyone does an equal number of jobs, not that one F1 is overflowed with a certain amount of jobs and the other ones don't do as much. So it's very important to do that. During your foundation training and your rotations, especially if you're interested in a specific field, so for example, surgery or medicine, you will get opportunities to do audits as well, and it's also a requirement in your portfolio. And we'll go into the portfolio in a bit more detail later on. And you'll get to be involved in meetings, like M&M meetings, morbidity and mortality meetings. Also, sometimes there are clinical meetings where interesting cases are presented as well. And that way you can also build on your own portfolio, on your own CV when you want to apply to a certain specialty. So all of that will be quite important to be part of. With regards to the portfolio, so something that no one really likes to talk about, the portfolio is found on Horus, and throughout your foundation training, you're expected to do different capabilities, so different mini-kexes, CBDs, different DOPs as well. You're expected to get all of those signed off. You're expected to do ALS or BLS, which is usually part of your training program. Usually they do that at the beginning of your foundation training. And also to write some reflective pieces. With regards to the portfolio, my top tip would be to start as early as possible and to regularly spend some time on your portfolio. So whether it's, for example, 1 hour a week to write a reflective piece on an interesting case that you saw, or to do some mini kexes, CBD. So you've just seen an interesting patient you'd like to discuss with your senior. Do that discussion and then ask your senior if you can get that signed off as a CBD, for example. So do it as you go along. That will be a lot easier later on, and it will prevent things from building up, especially before your ARCP, before your final panel date, where you get signed off. So that will be very important as well. And the last thing I would like to talk about is actually during your foundation training. It's quite a stressful period of time. You're just at the beginning of your medical career. You're the most junior person on the ward. So it's very important that you also maintain a good work-life balance, that outside of work, that you de-stress as well, that you keep yourself active with sports, with your hobbies. Definitely don't lose any of that, because it will make your work life also a lot easier that way. I really hope that my tips were useful. Please do use the links if you have any further questions, and I'll be very happy to answer your questions, and I wish you best of luck with your training.
The topic of sugar and the sugar addiction that our population is facing currently, and what impact it has in the current world that we live in. Like, it's permanent weakness on one part of their body. It causes kidney problems, heart attacks, and of course